I'm about to tell something that could save a life, and it has to do with a single morning habit that quietly raises diabetes risk in seniors, and almost nobody has been warned about it. I'm Dr. Claire Whitmore. After more than 20 years as a cardiologist, I've treated thousands of seniors whose hearts and brains were damaged not just by high blood pressure and cholesterol, but by blood sugar that crept up year after year. Again and again, older adults have sat in my office and said, "All I have in the morning is coffee." I thought that was healthy. My daughter told me fasting is good for me. Then we pull up the labs and we see prediabetes has become full-blown diabetes, or a stroke has already happened. By the end of this talk, seniors will know three things very clearly. First, whether a common healthy morning habit used by millions of adults over 60 is actually triggering insulin resistance and diabetes risk. Second, how that habit interacts with an aging metabolism and why seniors are not just older versions of 30-year-olds. Third, a simple, step-by-step way to change mornings so they protect memory, heart, and pancreas instead of silently damaging them. But I'm not going to name that habit quite yet. If I do, some seniors will say, "Oh, I knew it." Write down 3 words and click away, still missing the reasons it is dangerous after 60, and the tiny tweaks that can turn it from harmful to helpful. The why is what prevents strokes and heart attacks. Before going further, it helps me to know who is listening. In the comments, seniors can write age, diabetes status, and what normally happens in the first hour after waking. Just the basics like 74, prediabetes, just coffee, or 81, type 2, coffee and toast, or 69, none, skip breakfast. That snapshot tells me a lot about the risks we're dealing with. Now let me tell about Susan, because many seniors will recognize themselves in her story. Susan was 72, a retired school secretary, widowed, living in a neat little condo. She walked her small dog around the complex, volunteered twice a week at the library, and prided herself on eating light. She was not someone who lived on junk food or fast food. She believed she was doing most things right. In January, her numbers looked like this: weight 158 pounds at 5'3", blood pressure 138 over 82 on a low-dose ACE inhibitor, LDL cholesterol 118, fasting blood sugar 108. Her A1C was 5.9%, squarely in the prediabetes range. Her doctor said, "Susan, this is a warning sign. This is not diabetes yet, but the pancreas is working harder than it should. We want to stop this from progressing." He recommended smaller portions, more walking, a goal of losing 8–10 pounds. He added, "Some seniors do well with time-restricted eating, shortening the eating window. Skipping breakfast can help with weight if it feels comfortable." Susan latched onto that one phrase. Skipping breakfast can help. Her daughter had been on a health kick, talking non-stop about intermittent fasting and how she had dropped 10 pounds and felt amazing by not eating until noon. "I'm basically cleaning my body every morning," her daughter said proudly. Susan thought, if it works at 45, surely it works at 72. And breakfast has always been my weakest meal. Toast, jam, maybe cereal. I'll just cut that out. She built a new routine: wake at 6:30, take morning pills with a large glass of water, brew a big mug of strong black coffee, no sugar, just a splash of cream, sip slowly until about 8 a.m. while reading or scrolling the tablet, eat nothing until noon. Her daughter cheered. "That's perfect, Mum. You're doing the healthy kind of fasting." For the first 2 months, the bathroom scale cooperated. Her weight dipped from 158 to 153. At a quick visit, her doctor noted the weight loss and said, "Good job. Keep it up." No one checked what her blood sugar was actually doing across that morning window. Around month 3, little changes crept in. By 10:30 most mornings, Susan felt jittery, edgy, and intensely hungry. Despite her fast, she thought constantly about lunch. When noon came, she ate quickly, 2 slices of toast with cheese or a big bowl of cereal, sometimes a muffin. "I've earned this," she reassured herself. "I've been good all morning." After lunch, a wave of fatigue would hit. She often dozed in her chair with the dog on her lap, something she hadn't done in earlier years. At her next lab check in June, the numbers painted a different picture. Weight down to 152, fasting sugar up to 118, a 1C up to 6.2%. Her doctor frowned. "Your weight is down a bit, good, but your A1C is higher. The pancreas is under more strain. We're moving in the wrong direction." Susan protested. "But I'm fasting every morning, just black coffee. I thought that would improve my sugar." He said, "Patterns in seniors' bodies can be different. Let's watch it closely. Try to cut back some starches at lunch." She left more confused than when she arrived. I'm doing what all the health blogs say, she thought. How is this getting worse? Over the next 6 months, the pattern deepened. Many mornings she woke with a mild headache. She took pills, started coffee, and sometimes noticed her heart beating faster in her chest after the first cup. By 10 o'clock or 11 a.m., her hands would shake slightly. She felt anxious inside. She did not take a sugar reading then. The meter her late husband had used stayed in a drawer because she felt virtuous for skipping breakfast. She gave herself permission to be looser at lunch and dinner. A small dessert can't hurt if I haven't had breakfast, she told herself, adding cake at church lunches or ice cream at night. One Sunday after a potluck, she felt unusually thirsty and made 3 trips to the bathroom in an hour. At home, uneasy, she found her husband's old glucose meter, popped in a strip and tested. 2 hours after lunch it read 214. She stared. That can't be right. I only had 1 plate and dessert. She decided it was a fluke. She made no changes. By December, 11 months into the coffee-only morning, her checkup brought a shock. Fasting sugar 132, A1C 6.7%. Her doctor looked up from the results and said quietly, "Susan, this now meets criteria for type 2 diabetes." She felt like the floor dropped out. "But I lost weight. I fast every morning. How did I get diabetes?" he explained. "Skipping breakfast and having only coffee may be stressing your system. Seniors' livers and hormones behave differently than younger adults. For you, morning might be the worst time to fast." She heard the words, but mostly heard, "You have diabetes now." Guilt and anger swirled. 3 months later, a more dramatic event hit. One morning, she woke feeling a bit off, slightly more tired than usual. She took her pills, brewed coffee, and sat reading. Around 9:30, when she stood to feed the dog, her left arm felt heavy. When she called the dog's name, her speech sounded thick to her own ears, slurred, not quite right. She thought, maybe I slept funny on my neck. Maybe my jaw is stiff. She sat back down. Over the next few minutes, her left hand fumbled the pages. Her face felt strange. Then gradually, it passed. She did not call her daughter. She did not call 911. "I'm probably overreacting," she told herself. 2 weeks later, at a visit, she mentioned the episode almost in passing. Her doctor stopped and said, "Susan, that sounds like a TIA, a transient ischemic attack, a mini stroke. With your new diabetes and blood pressure, this is serious." Brain imaging later showed several small silent infarcts, tiny spots where blood supply to brain tissue had been briefly compromised. Years of blood vessel wear from high sugar, high pressure, and cholesterol were adding up. Her morning routine, which she believed was cleaning her system, had actually raised stress hormones, allowed liver sugar to run unchecked, and set her up for big midday spikes. The scale looked better, her arteries did not. A lot of that was preventable. Now let's step back from Susan's story and talk about what is happening under the surface. The morning habit in question, the one I see over and over in seniors, is simple: waking, taking pills, and then having only coffee or tea, no food for several hours. In other words, a coffee only or nothing at all morning. Younger adults doing this may get away with it for a while. Seniors are dealing with a different set of rules. In the early morning, the body naturally releases hormones like cortisol and growth hormone to get ready for the day. Those hormones tell the liver, "Release some extra glucose, fuel needs are coming." This is called the dawn phenomenon. It's one reason fasting sugars are often highest in the morning. In a younger adult with strong pancreas function and big insulin-sensitive muscles, insulin is released and muscles suck up that extra sugar fairly effectively. In many seniors, the pancreas is already a bit tired, muscles have shrunk and become more insulin resistant, and the liver tends to over-deliver sugar. Fasting sugars creep higher. Now add a strong cup or 2 of coffee on an empty stomach. Caffeine triggers adrenaline and bumps cortisol further. Those stress hormones tell the liver, again, "More sugar please." They also temporarily make cells a bit more resistant to insulin's signal. So in a 72-year-old with pre-diabetes, the combination of dawn hormones plus caffeine plus no actual food often leads to higher fasting sugars between waking and late morning, a pancreas that has to pump insulin against that resistance for longer, a brain and heart bathing in higher glucose for more hours. Then, when the first meal finally arrives, often a large carb-heavy lunch, several things line up badly. Hunger is stronger after a long fast, so portions are larger. Insulin sensitivity tends to be better earlier in the day than at midday. Delaying food may mean eating when the body is less ready to handle a sugar load. Sugar from the meal spikes higher and stays up longer. In younger adults with lots of muscle, that pattern is a stress test they often pass, at least for a while. In seniors with less muscle, stiffer arteries, tired pancreases, and multiple medications, that pattern pushes them from borderline to over the line. Remember, seniors are different in at least 4 important ways. First, there is less muscle mass. Muscle is where most blood sugar goes for storage and use. With age, especially without strength work, muscles shrink and lose glucose handling capacity. Long morning fasts do not make that sugar disappear. They keep it in the bloodstream and ask the pancreas to work harder. Second, arteries and small vessels are stiffer and more fragile. Years of even mild sugar elevation, blood pressure and cholesterol damage, the inner lining, the endothelium, big sugar swings, low in the morning from fasting, then high after a large midday meal, hit that lining repeatedly, increasing risk of heart attacks and strokes. Third, the hormone and nervous system responses are altered. Older bodies often have higher baseline stress hormone levels, blunted relaxation responses, and slower off switches. Going half a day with coffee only keeps the fight or flight side of the nervous system more active, which is bad news for blood pressure and sugar. Fourth, many seniors are on multiple medications. Blood pressure pills, diuretics, diabetes pills, sometimes insulin, sometimes steroids or other drugs. Taking some of these on an empty stomach can increase side effects or change how the body handles sugar later. Research backs up the concern about skipping breakfast in older adults. Large observational studies have found that adults who regularly skip breakfast have higher rates of type 2 diabetes and coronary heart disease than those who eat breakfast, even after adjusting for weight and some lifestyle factors. Trials in people with diabetes have shown that putting more calories earlier in the day, a bigger breakfast, smaller dinner can improve insulin sensitivity and lower 24-hour blood sugar exposure compared with the same calories eaten later. These studies are not perfect, but together they point one way. For many, especially in later life, completely skipping breakfast is more likely to harm than to help metabolic health. Here is where it gets tricky. Intermittent fasting has real benefits for some, but most of the bold claims online are based on studies in younger or middle-aged adults without multiple chronic illnesses. Watching a 45-year-old on YouTube rave about skipping breakfast and losing weight does not mean a 75-year-old with prediabetes and beta blockers will get the same result. In fact, the same pattern can backfire. So what is a safer, smarter morning pattern for seniors? The answer is not eat a giant breakfast no matter what. The answer is to avoid the combination of long, caffeinated morning fasts plus big midday carb loads, and instead give the body a small, balanced anchor early in the day. A practical approach looks like this. For a week, first just observe. What time do seniors wake? What pills are taken when? What is consumed in the first 2 hours? Coffee, tea, nothing, or food? Are there morning symptoms? Jitteriness, headaches, strong hunger, fatigue, shakiness. If a meter is available, check sugar on waking and again about 90 minutes after whatever the first calories are, even if that is just coffee. Patterns usually become obvious very quickly. Coffee-only mornings, 5 or 6 hour gaps before first food, heavy first meals, higher late morning or pre-lunch sugars. Once that map is clear, the next step is not a huge change. It is a starter breakfast, a small protein-containing item eaten within 1 to 2 hours of waking, on most days, even if lunch remains the main meal. That might be half a cup of plain or lightly sweetened Greek yogurt with a spoonful of nuts, or a boiled egg and half a slice of whole grain toast, or a small piece of cheese with a handful of almonds, or a small protein shake that is low in sugar. The idea is 8-15 grams of protein, minimal added sugar, and something that does not feel like a chore. Coffee can stay, but it should be tamed. For many seniors, coffee is safest when taken with or right after that starter breakfast, not an hour or two before any food. Seniors who drink several cups can try making one of them decaf or half caf and cutting back on sugary creamers and syrups that silently turn coffee into dessert. A simple experiment can be very revealing. On one day, test fasting, then drink coffee only and test again at 60 and 90 minutes. On another day, test fasting, eat a small starter breakfast plus coffee, then test again. If the coffee-only day adds 20-40 points while the breakfast plus coffee day adds far less, the body has expressed a clear preference. Medication timing should be reconsidered with the prescribing clinician. Some pills must be taken with food. Others can be adjusted to line up with the new breakfast. For seniors on sulfonylureas or short-acting insulin, timing them hours before the first calories is especially dangerous. Once a starter breakfast and coffee pattern is working, many seniors benefit from gradually shifting more calories earlier, making lunch the largest meal, keeping dinner lighter and earlier, and trimming late-night snacks. Studies suggest this front-loading helps sugar control and eases pancreatic strain. Adding a touch of movement after the starter breakfast, 10 or 15 minutes of gentle walking or indoor marching, can further improve how the body handles the morning's sugar release. Let me give a concrete example of what this looks like when it works. Robert was 73, a retired engineer with prediabetes for years. His A1C hovered around 6.2%. He considered himself disciplined. His routine: wake at 6, take blood pressure meds and metformin, drink 2 large mugs of strong black coffee by 8, no food, first meal at 12:30, usually a sandwich and chips, dinner at 7, often with dessert. He thought, I'm essentially intermittent fasting. This must be good. A new doctor had him wear a continuous glucose monitor for 2 weeks. The graph was eye-opening. Most mornings his sugar drifted from 100 up to the 130-140 range between 4 and 7 a.m. Thanks to dawn hormones. Each coffee bump nudged it another 15-20 points. By 10 a.m., still fasting, he was often 150 baths, 160. Lunch then pushed him into the 190s or low 200s. Dinner did the same. Overnight he came down, but rarely to the 90s. His A1C was now 6.5%. The diabetes line. His doctor said, Robert, your clean mornings are not clean from a sugar point of view. Let's experiment. They agreed on modest changes. A small breakfast at 6:30, half a cup of yogurt with walnuts, 1 cup of coffee instead of 2, a 10-minute walk at 7. If he needed, a tiny protein-rich snack at 10. Lunch a bit smaller and richer in vegetables, with chips only some days, and desserts a couple of times a week instead of nightly. 3 months later, a new CGM showed morning sugars topping out around 110-120, with gentle rises and slower peaks after meals. His A1C had fallen back to 5.9%. He felt less jittery mid-morning, less crashing fatigue mid-afternoon. Blood pressure readings shifted modestly downward as well. He did not adopt an extreme diet. He did not stop coffee. He simply stopped doing coffee-only mornings and gave his aging pancreas and arteries a kinder rhythm. That is the kind of shift that can turn Susan's story around if it happens early enough. Susan's experience reminds me how misleading popular health advice can be when it is not filtered through the lens of age. A 40-year-old can skip breakfast, drink coffee, run to work, and sometimes improve weight and labs. A 72-year-old with prediabetes, stiff arteries, and less muscle can follow the same blueprint and end up with diabetes and mini strokes. Seniors who have listened this far now understand that the common skip breakfast, just coffee pattern can quietly push prediabetes toward diabetes in older adults. Seniors' livers, hormones, muscles, and medications create a morning environment very different from younger adults. A small protein-rich starter breakfast within 1 to 2 hours of waking, coffee paired with that food instead of alone, and a bit of gentle movement afterward can improve blood sugar patterns and lower vascular risk. Individualization matters. Mornings must be tailored to age, lab values, medications, and how the senior actually feels. Information like this only protects if it changes behavior. That change does not have to be dramatic. It can start tomorrow with one simple decision. I will not do coffee-only mornings this week. I will eat something small with protein within 2 hours of waking, and I will tell my doctor what I'm trying so we can adjust medications if needed. Seniors can mark this moment in the comments with one of 3 words. Skipping. If mornings are usually coffee only or no calories for several hours. Changing. If there is a decision to add a small, smarter breakfast and maybe a short walk. Talking to doctor. If this has prompted a plan to review diabetes or pre-diabetes status and morning habits with a clinician. Those simple words can be the first written step away from a hidden risk and toward a morning routine that truly supports senior hearts, brains, and blood sugar. Disclaimer: the content in this script is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a physician regarding any medical condition. Never change medication timing or dosage without consulting your doctor, especially for diabetes or blood pressure medications.